Uh, Hello everyone. Good morning. Today I have come up with a new video that is related to team leader interview question, and I hope that will be very useful for those uh, who are giving IJP for team leader or management training or giving team leader interview for another company. You can go through this video. I have collected most 50 to 16 frequent questions which is generally asked if you are giving any interview for team leader. I hope this will be very useful for those who are preparing for IJP or any interview for team. Let's start for the from the first question, that is about it is generally asked about your introduction. So the experience and the date which I have shared here, it isn't just an example. It's not like true to my experience, right? Question one, that is introduce yourself. You have to answer in this way. First of in this, or your name, whatever, wherever you have worked, the duration and the role and the accomplishment and the work, what have you, how much time, how much duration, all these things you have to describe about in your introduction. Let's say my name is Arjun. I have started my journey with Madeline on February 3rd, 2010, joining the Advantia process after completing my mentorship on June 3rd, 2010. I was transitioned in high dollar projects where I gained valuable experience in navigating complex cases. Later on, I moved to TFL projects where I further honed my skills and adapted to new challenges. As I continue to grow in my role, I took on more additional responsibility by providing mentorship and training to new users, helping them navigate the intricacies of our system and process. After 2 years of dedicated work and contributions, my efforts were recognized and leading to a promotion of quality specialist. In this role, I focused on ensuring the efficiency and accuracy of my process. You have to mention the process names where now you are leading as a quality specialist. By closely examining the workflow and identifying the areas of improvement, I implemented several changes that enhanced our process and streamlined our procedures. Through collaborating with my team members, leveraging my expertise, I was able to make meaningful contribution to our overall performance. Throughout my journey at company, you have to mention the company name wherever you have worked as of now. Throughout my journey I embraced several challenges, sought out opportunity for growth, consistently delivered results. My dedication to continuous improvement and commitment to excellence has been instrumental in driving positive change within the organization, and eager to continue making valuable contribution to the success of our team. So in this way, you have to give your introduction. You can modify as your experience, as your work role. Accordingly, you can do that. Second question they are generally asked: how will you motivate your team and yourself? I will motivate my team by setting clear goals and expectations and celebrate achievements, offering praise and recognition for good work, and provide opportunities for growth and training, encourage teamwork and collaboration, and lead by an example with positive attitude, show appreciation for each team member's contributions, and provide support when needed. By creating a supportive and rewarding work environment, I will keep my team motivated and engaged. I will motivate myself by setting clear goals, breaking tasks into manageable tasks, and visualizing success. Celebrate. So from here, from first paragraph is it's all about like how will you motivate your team. From here to here, I will motivate my team. So I will keep my team motivated and engaged. From the second paragraph, it is about how will you motivate yourself. So I will motivate myself by setting clear goals, breaking tasks into manageable tasks, and visualizing success. Celebrate progress and reward myself for achievements along the way. Stay positive, stay organized, and take breaks when needed to recharge. Surrounding myself with sources of inspirations and seek support from friends and mentors. By practicing self-care and maintaining a positive mindset, I can stay motivated and focus on achieving my goals. So these are the ways of where you can motivate your team and you can motivate yourself. The next question is, what are the responsibilities of a team leader? So you have to mention what are the roles and responsibilities of a team leader. So let's start from the first point, that is he should be a leader. He should be able to resolve any problems and able to lead the team to achieve their goals and organization goals. Second one is he know how to organize tasks, whatever assignment or inventory he has, assigning to the user and making them to complete in a specified given time. Solve the problems. When several users works together and you are leading a team, it is obvious that problem may arise due to several issues like inventory leak, calling peer issue attrition, and he should know how to resolve those issues because he is his work, right? Next one is support the team. He should know how to encourage the team and motivate the team and show them the career growth path or any achievements and not take the credit, give the credit to the team. Lead the team. He should be very well efficient in leading the team and make them motivate to achieve their KRAs and achieve organizational tasks. Next one is evaluate performance. He should be visionary and whatever task given to the team, and at the same time to monitor the assigned task and evaluate their performance. Next one is allocate resources. He knows very well how to allocate resources and it should not be done any prejudice while allocating resources. Next one is develop the skills. Encouraging team to participate in training sessions like Excel's bootcamp data visualization so that they can enhance their skills. These are the points that they should have that roles and responsibility, and you can use these points with a trick that is boss lead. B stands for be the leader, O stands for organize task, S stands for solve the problem, S stands for support the team, L stands for lead the team, E stands for evaluate performance, and A stands for allocate resources, D stands for develop skills. These are the points you should remember. Next one is, what is SLA? SLA stands for Service Level Agreement. That is a formal contract between service provider and client that outlines the expected level of service. SLA for the this is the definition for SLA. That is, it is an agreement between a service provider and a client, and which client expects some level of service. So it varies from process to process. I am giving an example of the current process. Let's say SLA for the current process, that is 365 days plus a year, should not be greater than $255K, and unavoidable right of adjustment cost should not be greater than $500K. So these are the SLA for one specific process. It varies from the process to process, depends on the client needs, what he expect from that particular process, right? But so you must know definition, and if you are giving any interview, so you should know the in process you are working, you should know their SLA. It's SLA. Next one is, how will your observation lead to the tangible reduction in FTE? First of all, understanding this question, we should know what is observation and what is reduction in FTE. So first of all, observation is that any practice, any efforts you have made to make the improvement in process or any reduction in efficiency, means if any users, few users are working unnecessary work, and like five users are doing that work which can be done by only one users, so that sort of inefficiency, if you have you know the process to reduce that inefficiency, so the practice which you have made to reduce that, that is called observations, right? And reduction in FT, we will understand what is the FT and what will, and how will calculate FT in this paragraph as itself. So the question, the answer for this question is, as a quality specialist, you can, if you are working as an AR or account receivable or quality specialist, so accordingly you can manipulate your answer. As a quality specialist, my observation can lead to tangible reduction in full-time equivalent by identifying inefficiency and suggesting improvements. Let me give you an example. In our process as per SOP, if CPT 83036 is denied, we need to adjust. But our FTEs means users, but our users are doing it manually. And I reviewed those accounts and found 950 claims of $56,050 were like this, which was adjusted manually. So I suggested the team make automation on it and can apply a TV drill on it, and users can work on the other denials, which reduces the reduction in penalty. Means as per SOP, the CPT was denied, and if we have the guidelines, we can adjust it if it is denied. But users were reviewing it and adjusting manually. So I suggested a feedback that we can make an automation TBTL on it, and the users which are reviewing and adjusting it manually can work on other denials, so that uh, we can save the save that users production. They can work on other denials instead of doing adjustment. Right, in this way I have given that observations. Next one is other examples. What users were doing, 450 claims or approx $60,000 were filed with Railroad Medicare. They were putting in notes that they were unable to reach out the payer Medicare Railroad. So they escalated to CBO. So I reviewed the account and audited the claim and found they were using the incorrect PTA number. Whenever a call is required to Medicare, they ask for PTA number, provided transaction access number. And I'm unaware of how to use the IVR conversion tool. So I provided the correct P10 and made them make correction on all those accounts, and then all claims were settled. It helps in the reduction of 0.5 FTE. Now let's understand how to calculate FTE. Let's say a user has 40 claims target per day and working for 22 days, because in a month 8 days will be week off, and 22 days that the user would be working for that particular month. So he worked 880 claims per month. And if you are sharing any observation that includes 880 claims, it means you reduces 1 FTE, right? Next question is, does encourage and motivation will make user to increase productivity and get motivation? Yes, encouraging and motivating people can make them more productive and motivated. Here is how. Praise and recognition. When people get praise for their good work, they feel happy and valued. This makes them want to keep doing a good job. Next one is clear goals. When people know what they need to do and what goals to achieve, they work better. In short, when people feel appreciated and supported, they work better and feel more motivated. What is the difference between KRS and KPI? Key performance indicators are metrics used by organization to measure their employees' efforts and suggest improvements. And key result areas are a set of goals and objectives that each organization assigns for their employees at the beginning of their evaluation period. So these are the difference between KRS and KPI. Basically, KRS are a set of goals and objectives that needs to be achieved against the organization goals, you can say. And KPI has also that employees have to achieve, but it is a measurable performance metrics. Measurable, let's say, with the understand with examples. If you're working as a quality specialist anywhere, right? And your KRS would be like to audit claims, to provide uh, refresher session, to provide meetings with the operations, and to like training with the operations. You might have some error rate, right? And you have to give observations. So these are the KRS. But when we have the measurable metrics, means you have to audit 40 claims per day, you have to give one refresher training per week, you have to give 5% error rate per month, you have to give one observation in that particular month. So in this way, now it is measurable. You can measure that. If you have achieved 30, if you have audited 38 claims for that particular day, but your target is 40, so we can measure that, yeah, achieved like 98 to 90 97 to 98% target for that particular day. So when you can measure your KRA, that is called KPI, right? KPI is a measurable performance matrix. In key area, just a set of goals that need to be achieved against their organization goals. Why should I hire you as an MT team leader? Answer that you should hire me for the MT profile because I believe I am strong and in this question you have to uh, share your skills, additional skills or any ability you have from the different from the different one, right? If you have any ability that is different from your competitor or any special skills you have gained through your experience, so you have to share these things. You should hire me for the empty profile because I believe I am a strong and continuous learner, dedicated to my work and efficient in handling a team. Since I have already handled a team of 40 users from a quality perspective, have experience handling CPU and efficient in problem solving. I'm dedicated to the work that is assigned. Question 9, that is what is AR days? How will you calculate AR days? AR days basically it measures the average number of days it takes for a healthcare provider to receive payment after providing a service. AR days is equal to total outstanding AR insurance plus patient divided by average daily revenue. This is the formula for AR days. Average daily revenue. And how would you calculate ADR or average daily revenue? To calculate ADR, let's say you can have to calculate average daily revenue for 180 days. So first of all, you have to total charges posted for 180 days divided by 180. You will get the ADR, average daily revenue. Right, in this way you can find out the AR days. Why do you want to be the MT team leader and not quality leader? So I have answered this question in two paragraphs. In first paragraph, I have mentioned why do you want to be team leader MT. In second question, I have mentioned why do you want to be MT rather than quality leader. So the first one is I am eager to transition my role into MT profile because I am deeply committed to advancing my career and expanding my skill set. While working as a quality specialist has equipped with various insights into process improvement and maintaining high standards. But now I want to broaden my horizons and take on a more strategic and leadership oriented role. Becoming a team leader or MT in operation presents an exciting opportunity for me to develop the comprehensive understanding of various aspects of business, exposure to different departments, and cultivating the leadership skills necessary to drive impactful changes and contributing to overall productivity and growth to the organization's success. I am highly enthusiastic about the prospect of embracing new challenges and making a meaningful impact in this managerial role. Right. Next one is why do you want to be team not quality leader? So while in this question, like you have to answer why do you want to be leader in operation, not in. So you can say like uh, you want to be you want to further utilize your leadership skills and you want to like strategic planning. You can get resource allocation experience over there. So these are the things you can mention, which I mentioned. While my background as a quality specialist has provided me a strong foundation in maintaining high standards and process improvements, I am drawn to the operation aspect of business and eager to deepen my understanding in this area. Becoming an MT in operation presents an opportunity for me to gain hands-on hand experience optimizing process and contributing to the organizational growth and success. By immersing myself in operation, I aim to develop a well-rounded skill set that encompasses not only quality management but also strategic planning, resource allocation, and problem solving on a broader scale. I believe that this diversified experience will ultimately make me in a position to make an impactful change within the organization and advancing my career in a direction that aligns with my long-term goals. Right. Next one is, what are the key areas of MT? Team performance, that C rater should not be more than 20%, and its weightage would be 35%. Next one is team quality, that should not be less than 90%. Its weightage is 35%. Attrition rate we will study it further. Attrition should not be more than 3.3%, its weightage is 20%, and absenteeism should not be more than 10%, its weightage is 10%. These are the key areas of team leader rank. What changes will you make if you get selected as a team leader? So you can modify your answer, but the answer which I have mentioned, also you can consider this. I would focus on, if I selected as a team leader, clear communication. I would ensure that everyone understand their roles and responsibility through regular team meetings and individual check-ins. Empowerment, giving team members more autonomy and trust to make decisions within their expertise, fostering a sense of ownership. Skill development, prioritizing continuous learning and develop opportunities to enhance their skills, which can help in their career growth path. Next one is feedback culture, establishing a culture of constructive feedback and recognition to motivate the team and performance. Next one is process optimization, to identify the areas of improvement in the process which can enhance the process efficiency. So these are the answers which you can say if it is asked changes you will make. So there is a trick to remember these points, that is successful. It sounds like safety. C stands for clear communication, E stands for empowerment, S stands for skill development, F stands for feedback culture, and P stands for process optimization. Right. How will you reduce the gap between quality and operations? So like why, for answering this question, uh, firstly you should know that, is there actually gap between operations and quality? Yes, sometimes it happens. Like uh, there is a hustle between them, between quality and operation. So generally reducing that gap, your what would be your strategy? So that's why this question is generally asked. So the answer would be that shared goals ensure that we both quality and operation have common goals which contribute to the organization's success. Second one is cross-functional collaboration, foster teamwork between quality assurance and operations. Like we have to make sure that teamwork should be there between quality assurance and operations. Regular communication, establish ongoing channels for sharing information and feedback. Next one is integrated process, incorporate quality checkpoints into operational workflows. Next one is training and awareness. You have to provide cross training opportunity to enhance understanding of each other's role. And there is also a trick to remember this one, that is SCRIT. S stands for shared goal, C stands for cross-functional collaboration, R stands for regular communication, I stand for integrated process, T stands for training and awareness. Next question is, what is the difference between SLA and KPI? We have already gone through about this. What is the difference between SLA? What is SLA and what is KPI? Now it is asking the difference between SLA and KPI. So SLA is service level agreement between the service provider and clients that outlines the expectation from the service provider. Basically, it is an external agreement on service quality. And KPI is a matrix used to measure how well an organization achieving its goal. It is an internal measurement of performance. If you were given a team, how will you handle the team? Handling a team effectively involves a combination of leadership skills, communication, and strategic planning. So he should be the leader. I will lead the team by team engagement first, understanding their pros and cons, and having one-on-one and having an open and transparent channel where they can share their feedback. Organized task. I will organize the task into manageable tasks and assign them properly and making them understand their roles and responsibility clearly. Support the team. I will support the team and empower them and trust them. They can make the decision with their expertise and try to make a constructive feedback channel. Next one is solve the problems. When I will be leading a team, it is obvious that problem would arise. I would solve the problem instantly and effectively and monitor the all users if they are facing any problems. Lead the team. I will lead the team by example and will demonstrate behavior, what I expect from the team. I will show commitment to achieve goals and take participate in team activities. Evaluate performance. I will keep monitoring the performance and keep regular meeting and check-ins and would provide constructive feedback on the basis of it. I will allocate the resources smartly and without any prejudice. Develop skills. I will prioritize continuous learning and foster skill development sessions so that they can enhance their skills and use their skills in the upcoming IGPs. Do you work on any project which reduces FTE? So as we already answered this question, the above section, that is, let's do it again. So as of now, working as a quality specialist, I worked on several observations which help in reducing FTEs. And our process as per SOP CPT 83036 is denied. We need to adjust, but our FTEs are doing it manually. And I reviewed those accounts and found 950 claims of $56,050 were like this, which was adjusted manually. So I suggested the team make automation on it and can apply a TPT on it. And users can work on other denials, which reduces the reduction in 1FT. Next question is, if your process is down due to IT issue, how will you utilize your team? So you have to answer very smartly. Like you can provide trainings during that time. You can provide other sessions on the quality like this. So there are a few points which I mentioned, that is shift to other tasks, focus on administrative work, training and team building activities, plan and strategies, reassess goals, brainstorm future projects, and discuss process improvements. Prepare for resumption, organize and prioritize tasks for when the system is back up. Use alternatives, switch to manual process or alternative tools if possible. Next question, what are the reasons that caused ASDR? There are several factors that caused ASDR, so I need to do the inventory. What is causing ASDR? If you don't know what is ASDR, we will understand this later. Yeah, now let's understand now. ASDR basically, it is the time frame, it is the amount of time from which that claim is waiting to get the payment on it. From when? From that when claim is billed to payer. Means there is a claim which is billed to payer, but if payment has not been done yet on that claim. So that is the aged of that claim, right? If that claim is aged, that would be if the higher the aged year of that claim, the less probability that it would get paid. So what we have to do, we try to do to reduce that claim within the less aged, right? There are several factors that caused ASDR, so I need to do the inventory. What is causing ASDR? Either it is credentialing issue or clearinghouse issue. As of now, we are facing two challenges in our process, which is causing ASDR. It is as follows. Since our change healthcare or clearinghouse is not working, so we are unable to file the claim electronically, which is causing the ASDR increased. For few specific payer W9 form. What is W9 form? W9 form basically it is a form to update the address with the payer, with the insurance, to update the provider payer, or to update the provider address with payer, right? So we use W9 form to do that. For few specific payer, W9 form was not updated, and due to which the payment is receiving to incorrect address. So we recently updated the W9 form with the payer and getting payment at the correct address, and it also increased ASDR. Claims were stuck in credentialing workflow, so I escalated to CBO team to work on the credentialing claims to make provider credentialize so that we can work on it and can reduce the ASDR. What is the standard percentage of ASDR? That should not be more than 90. that that should be 10 to 15%. We can consider only 10 to 15% claims more than 90 plus bucket. If more than 15% are claims above more than 90% bucket, means your process is not going in the right way. So we try to reduce that. What are the KPI or metrics what client expect from us? There are few metrics. There are few metrics or KPI through which we can calculate that our process is in the right way. First one is FPRR, first pass resolution rate, is the percentage of claim billed to payer and get paid by the payer in one go without any manual intervention. And it should be approx more than 90%, which shows that we are in the right direction. To calculate FPRR, total claim billed and paid in one go, multiply 100 divided by total claim billed for that specific period. Next one is net. These are the metrics. Second one is net collection rate. NCR is the percentage of total claims paid for the specific period of time divided by total charges billed minus contractual adjustment. Or we can say, to calculate NCR, total claims paid multiply 100 divided by total charges minus contractual adjustment or allowed amount. We can also say in the other words, total claims paid multiply 100 divided by allowed amount, because total charges minus contractual adjustment is equal to allowed amount. Next one is denial rate. Denial rate is the percentage of claims denied by payer for the given time. A low denial rate reflects a healthy cash flow. The low the denial rate would be, it means the higher we have healthy cash flow. To calculate denial rate is equal to total dollar amounts of claim denied divided by total dollar amount of claims billed. AR days. AR days measures the average number of days it takes for a healthcare provider to receive payment after providing a service. To calculate AR days, total outstanding AR divided by ADR. Standard AR days is 30 to 50. Next one is average reimbursement rate. Average reimbursement rate is the percentage of the claim where insurance pays for the given time divided by the sum of total fees billed. It should be 35 to 50% as per physician standards. To calculate average reimbursement rate is equal to sum of total payment received divided by sum of total fees billed. What is the difference between clean claim and FPRR? There is a very small difference between clean claim and FPRR. Basically, what clean claim say? Clean claim is that claim which is billed to payer without any rejection, or without any step in uh, clearinghouse. And FPRR is that first pass resolution. That claim is that which is billed to claim in one go and get paid. Right. So I hope you are understanding the difference between clean claim and FPRR. Basically, clean claim is nothing to do whether it is paid or not. It is just only it should have been billed to payer with in one go without any rejection in scrubber, in our scrubber. But FPR, that claim that says about it should have been. It doesn't matter that it is billed in one go or two go through rejection, but when it is billed to payer, it should get paid in one go without any manual intervention. That's all first pass resolution says all about. Right, this is the difference between clean claim and first pass resolution, and we have already know the formula about clean claim rate and first pass resolution rate. To calculate clean claim rate is equal to claim billed without any errors and one go divided by total claim billed. Multiply 100. Now, FPPR, first pass resolution rate, is the percentage of the claim billed to payer and get paid by the payer in one go without any manual intervention. And it should be approx 90 to 95%, which show that we are in the right direction. To calculate FPRR, total claim billed paid in one go, multiply 100 divided by total claim billed for that specific. What is the difference between NCR and GCR? NCR stands for net collection rate, GCR stands for gross collection rate. NCR is typically calculated as the ratio of the payment received to the total amount of payment expected based on allowed charges. And formula is total claims paid multiply 100 divided by allowed amount. This is the formula for net collection rate. Next is the gross collection rate, measures the total collection received as a percentage of the total charges billed for service provided without considering any adjustment of contractual allowances. Total claims paid multiply 100 divided by total charges billed. What are the two service not covered by Medicare? That is dental and vision. What are the two conditions where payer need authorization? The first condition is high dollar service or surgery code. Second condition, when service is taken from out of network provider. Next one is what is NCCI conflict? NCCI conflict refers to violation of coding rules set by the National Correct Coding Initiative (NCCI). It occurs when claims include coding combination that do not comply with the NCCI edits, leading to potential claim denials or improper payments. NCCI edits consist of two types: procedure to procedure (PTP) edits. These identifies pairs of healthcare common procedural coding system ethics divided by current procedural terminology (CPT) codes that should not be built together in certain circumstances. Next one is medically unlikely ethics. MUs. These define the maximum unit of service that can be reported for specific HCPCS CPT codes on a single date of service by the same provider for the same beneficiary. Next one, you have less cash flow previous month and your supervisor asks the reason for this. What will you do? So you have to answer in this way. I will review the inventory first and identify contributing factor such as delayed payment or increased expenses. I will analyze metrics for that month, including FPRR, ARDs, denial rate, net collection rate, and average reimbursement rate. If the issue is related to high denial rate or low PPR, I will investigate root causes such as credentialing issues, coding denials, or clearinghouse delays. I will collaborate with the billing, coding, and credentialing teams, sharing insights and examples to discuss solutions for prevention in the future. I will prepare a concise report outlining the reasons for the lower cash flow and propose strategies to improve it. I will then present my findings clearly to the supervisor to effectively address concerns and seek their input on potential solutions. In this way, what we have to do, we found that cash flow is less previous month, so you have to firstly identify the root causes. What is the reason behind less cash flow, and how can you do that? You can like use the RCM matrix, average denial rate, FPRR, average reimbursement rate, and clean claim rate, FPRR. You can finding these metrics. You can compare this matrix with the previous month, from through which you will get the finding where is the root cause. Either it is clean claim rate is less, or FPPRR is less, or the denial rate is high, average reimbursement rate is less. Through which when you will find out the root cause that wherein you are lacking. If the denial rate is high, so you can review that why denial rate is high, in what portion denial rate is high, and accordingly you will work. And after making a concise report, reviewing all those things, you will keep that report to your supervisor, and after discussing with supervisor, you will propose an idea how to resolve that, and also need to take the support from your supervisors. So in this way, you can find out the reason for less cash flow and the solution to reduce that. What will you do to reduce denial? I will analyze the inventory and try to find out the trend by pair, denial, and dollar amount. I will pivot on the inventory and check the top 10 most denials. If there is a registration denial, we can resolve it ourselves. However, if we receive the maximum denial for registration issues, we will discuss it with the billing team. Because we may not be filing with the correct registration, I will share denial examples with them and ensure that we file claims with correct registration to prevent future denials, thereby reducing registration denials. If we have the most coding denials, I will review the most common scenario. For example, if we have many modified denials, such as Medicare not accepting modified denial, I will discuss it with the coding team. I will suggest using modified XU instead of modified 59 to prevent such codings denials in the future. For denials related to credentialing issue, I will escalate them the credentialing team to credentialize the provider. I will prioritize a few specific users for high dollar claims and keep a few specific users in the 60 to 90 days bucket to prevent them from aging into the 90 plus day bucket. Next question is what is MSP? In healthcare, MSP Medicare secondary payer refers to Medicare secondary payer. It is a term used to describe situations where Medicare is not the primary payer for healthcare expenses. Other insurance plans such as employer-sponsored insurance or auto insurance may be the primary payers. Medicare becomes the secondary payer. So MSP code basically it is the code in which Medicare shows that why are they secondary. Question 29 is what is Medigap? Medigap is a private health insurance policy that helps pay for healthcare costs that original Medicare does not cover. It is also known as Medicare supplement insurance. Next question is, did you do any RCA in previous month and on which reports you work? RCA stands for root cause analysis for any problems. You can find out the reasons why this is happening, what are the major causes for it. So to finding that we do RCA. Yes, I conducted an RCA last month on error reports. I found that 80% of errors were due to incorrect adjustment codes and incorrect deployment, while the remaining 20% were attributed to incorrect activities and inappropriate notes. As a quality specialist, I handled various reports such as sharing quality reports with operations, providing weekly RCA for error trends, working on calibration reports, and sharing audit insights weekly and monthly with my supervisors. What is the difference between AR days and claim days? Basically, AR days is the average number of days it takes to collect payment after the service are provided. Claim age, it refers to how long a specific bill or invoice has been waiting for payment since it was sent out. It helps track the time elapsed since a claim was submitted until it gets paid or addressed. The key difference between AR days and claim age is AR days is about overall payment collection efficiency, while claim age tracks the aging of individual claims specifically. Next question is, if you're selected as a team leader and your team not accept you, what will you do? I will focus on building rapport and will involve in team engagement. I will clearly communicate goals and expectation to align everyone towards common objective. I will listen actively to team members' concerns and address them transparently. I will encourage collaboration and involve team member in decision-making process. I will demonstrate leadership qualities through actions, empathy, and consistency. Next is what are your achievements? So uh, you can answer this question in your way, like the role in which you have worked and the if you have gone through any out of box and provided the solution of any problems, you can mention over it here, right? I have given you one of the examples. You can modify it as your work role. While working as a senior analyst in IMH commercial process at, yeah, you have to mention company name. I successfully led several projects under the guidance of my manager. At one point, there was a significant issue where several claims stuck with Aetna, causing aging AR due to users' inability to reach the pair. To resolve this, I utilized the ability portal to send inquiries resulting in a case ID and get the response within 3 days. I promptly informed my manager who then assigned me an inventory of approximately 1,000 to 1,200 Aetna claims. to resolve within a week. Leading a team of 5 users, I successfully completed the project within the specified team. In my current role as a quality specialist, I have provided several observations to improve process. For instance, I found that 450 claims, totally approximately $60,000, were filed incorrectly with Railroad Medicare. Users had noted inability to reach the payer, escalating to CPO. After auditing these claims, I discovered incorrect PTN numbers and educated the team on using the IVR conversion tool. I provided the correct PTN and guided correction across all accounts, resulting in the settlement of all claims and reducing FTE by 0.5. Next one is tell me about your company values, partner with purpose, think boldly, go beyond. Next is what is attrition and its formula. Attrition, basically, in short, if you understand, attrition is that condition where the employees are leaving the job due to any issue, whether it is resignation, abscond, retirement, any issue. Attrition generally refers to the reduction in the size of a workforce or customer base over time due to natural or intentional causes such as retirement, resignation, or customer churn. In business context, attrition can also refer to the reduction in the number of customer or clients. Function or attrition rate formula. So, formula for attrition rate. The attrition rate can be calculated using the following formula. Attrition rate is equal to number of employees who left during a period multiply 100 divided by average number of employees during the same period. Number of employees who left during a period. This refers to the total number of employees who resigned, retired, or were terminated, or the number of customers who stopped using the services. Average number of employees or customers during the same period. This is the average count of employees or customers over the period being measured. I will calculate average number of employees. Average number of employees will calculate employees at the starting of period plus employees at the end of period divided by 2. What is shrinkage and its formula? Shrinkage, in short, if you understand, shrinkage is that amount of time in which that employees are unable to work due to any IT issue or any other issue which is making him not to work. So that is called shrinkage. Shrinkage in business operation refers to the amount of time that employees are not available to handle customer contacts or perform productive work. It accounts for factors such as breaks, training times, meetings, vacations, and absenteeism. Shrinkage is important in workforce management as it helps in scheduling and forecasting staffing needs accurately. The formula to calculate shrinkage percentage is equal to total time unavailable for productive work multiplied 100 divided by total scheduled hours. This is the formula for shrinkage. Next one is what is absenteeism and its formula. Absenteeism refers to the unavailability of the users from work with permission or without permission. To calculate absenteeism rate, there is a formula total number of leaves multiply 100 divided by total number of working days. This is the formula to calculate absenteeism. Next question is if the user asks for the leave for the same day, as a team leader, what will you do? As a team leader faced with 2 employees requesting leave for the same day, I will assess the impact on the team workload. If both requests are approved, I will discuss with both employees to understand the urgency and importance of the leave request. Based on policy, seniority, critical roles, and leave history, I will make a fair decision. I will promptly inform both employees of the decision and any alternative arrangement if possible. Finally, to ensure team targets are met, I may ask another team member to handle a few extra teams. In this way, I will handle this scenario. If your attrition rate gets high for the last few months, few previous months, what will you do? If the attrition rate is high in the last few months, I will identify reasons for attrition through surveys, through exit interviews, and team discussion. I will implement retention initiatives such as career development programs, improving work-life balance. I will enhance employee engagement through regular feedback sessions, recognition programs, and creating a positive work environment. I will continuously monitor attraction. I will continuously monitor attrition metrics and adjust strategy as needed to stabilize the workforce. Implementing these steps can help mitigate high attrition rates and foster a stable and engaged workforce. Okay. Next question is what is RACI matrix? A RACI matrix is a project management tool that clarifies roles and responsibility by assigning. R stands for responsible, those who perform tasks. A stands for accountable, those answerable for task completion. C stands for consultative, those whose input is sought. I stands for inform, those kept updated. Basically, RACI matrix is a project management tool in which if you are giving any project and we have to make a RACI matrix in which all the things are mentioned over here, that the responsibility who is taking that, who one will be the accountable, one will be the consultant. We all mention these things with the help of RACI matrix. It helps team understand who does what and ensures accountability and improves workflow efficiency by defining roles clearly. Next one is what is non-availability statement. A non-availability statement is a document or declaration used in various contexts such as healthcare or insurance to certify that a particular service or item is not available within a specific facility, provider, or location. It serves as formal proof that attempts were made to obtain the needed service or item, but it could not be sourced due to unavailability. This statement is often required for claims processing or reimbursement purposes, ensuring transparency and justifying alternative solution. Basically, in short, if you can try to understand what is non-availability statement, it is a statement if you are if any patient is going to any facility for any treatment, right, and but facility is unable to provide that treatment due to absence of uh, any machine or any that machines which is used in the treatment of that disease, but facility don't have uh, that machine that time. So in that case, facility provide an non-availability statement to the patient in which it is written that we are unable to treat the disease due to absence of this machine at this location. That is called non-availability statement. Next question is, if your client give 2000 claims and your team capacity has 600 claims, in that scenario, what will you do? If I face such situations, first of all, I will focus on high dollar claims, which impact revenue or patient care first. Thereafter, I will distribute the claim based on urgency and complexity. I would try to take support from the other FTs, or I will ask my team to stretch a little more or work on weekends as OT. I will inform the client about expected processing timeline and manage expectations. Right, basically, first, what will you do? You will try to work on high dollar claims. After working on high dollar claims, you will try to take support from other FTs from the different department so that they can reduce few claims. And you will also try to make work your team in weekends as OT, and also try to ask the client for some extension to finish that project. Right. Next question is, how will you check LCD guidelines? LCD stands for local coverage determination. Is a set of coverage coverage guidelines created by Medicare Administrative Contractors (MACs) that specify the condition under which Medicare will cover certain medical services, procedure, or supplies. How to check LCD guideline concisely? Visit the Medicare coverage database MCD, assess the MCD website provided by CMS. Search for LCDs. Use the search functions to locate LCDs relevant to your specific medical service or item. Review LCD details. Click on the. So I have mentioned a link wherein you can go through that. Go through this link and you can use LCD lookup to find the criteria for that. What is CMF? CMF basically it is it stands for Consequence Management Framework that covers the process outlined to oversee performance management, discipline management, and grievance management. The Consequence Management Framework oversee performance, discipline, and grievance management. Performance management, it sets goals, monitor progress, provides feedbacks, and rewards achievement. Discipline management, it defines policies, investigate issue fairly, applies corrective action, and ensures due process. Grievance management, it establishes procedures for employees to raise concerns, investigate complaints objectively, seeks resolutions, and promote workplace harmony. These processes ensure alignment with organization values, legal compliance, and continuous improvement in managing employee conduct and performance effectively. If one user achieved 81% for a month, and then 100%, and then 91% for a consecutive month, so what will you do? Since our goal is to achieve 100% KRAs, initially I will give documented feedback to that ensure understanding. If the issue still persists, I will issue a warning letter through Workday following our consequence management framework for disciplinary management. If needed, I will escalate the matter to HR for further action. Next question is difference between follow-up on between hospital and physician billing. So for the answer would be hospital billing claims follow-up deals with a broader range of services provided by hospitals, while physician billings claims follow-up is more specialized to services provided by individual doctors or medical practices. Both processes aim to optimize revenue collection by addressing claim denials, ensuring coding accuracy, and facilitating timely reimbursement tailored to the unique billing environment of hospitals and physician practices. As we already know, the difference between hospital and physician claims is works on the particular provider, but facility works on a broader range of services, including several physicians. Right. Next question is how will you allocate claims if you work as a team leader? So you have to answer in this way. As a team leader, allocating claims would be in this way. I will assess workload first, evaluate team capacity and prioritize claims based on high dollars, urgency and complexity. Skill matching, assigning claims to team members based on their expertise and proficiency. Monitoring, I will monitor, track progress and provide support to ensure timely resolution of claims. Next one is quality assurance, review completed work for accuracy and compliance with billing standards. Feedback and training. Provide feedback and ongoing training to improve efficiency and effectiveness in claims processing. By effectively managing claim allocations, you ensure equitable distribution of workload and optimize team performance in handling claims. Next question is, if someone is on PIP, how will you give him feedback? If someone is PIP, the feedback would be in this way. First of all, that would be clear expectation. I would reinforce specific goals and expectation outlined in the PIP. Constructive criticism. I will provide honest and constructive feedback on areas needing improvement. Support and guidance. I will offer resources, training, or mentoring to help the individual succeed. Regular check ins. I will schedule frequent meetings to monitor progress and offer guidance. Positive reinforcement. I will recognize and praise improvements made during the PIP period. Effective feedback during the PIP should be supportive, specific, and focused on achieving the agreed upon performance objectives. If you're getting escalation from clients, how will you prevent it? To prevent escalation from clients, proactive communication. I will maintain regular updates and transparent communication with clients about project status and potential issues. I will maintain regular updates and transparent communication with clients about project status and potential issues. Address concerns promptly. I will quickly address client concerns or complaints to resolve issue before they escalate. Quality assurance. I will ensure deliverable meets or exceed client expectation through rigorous quality checks and reviews. Next is relationship building. I will foster strong client relationships based on trust, empathy, and understanding of their needs. Next one is continuous improvement. I will learn from past escalations to improve process and prevent similar issues in the future. By implementing these strategies, I can mitigate risk of client escalation and maintain positive client relationships. Next question, what is DRG group, stop loss and revenue group? DRG group, it is diagnosis related group. DRG groups together hospital cases With similar diagnosis and treatments, it helps determine how much hospitals get paid for treating patients based on these groups. Next one is stop loss. The stop loss basically it is a limit on how much someone has to pay out of pocket for medical expenses. It protects against very high medical bills by capping what you need to pay once you reach a certain amount. Let me tell you what is stop loss in short. Basically, let's say you have a like uh, you're like you have some issue and you are a patient and that claim was billed to payer and payer initially paid some amount and left $500 as a patient responsibility, you can say out of pocket expenses, right? So but uh, $500 is too much for you, so and you have a stop loss. So what a stop loss would do, it will capping on the out of pocket expenses. Let's say it has a capping for $200, so you have to pay $200 for as a out of pocket, and after that more than $200, that stop loss insurance will pay more than that, the capping which uh, it has capped on that amount, right? So I just give you an example. The amount may be different, right? What a stop loss has decided, and what the decision taken between you and a stop loss. It depends. Just I give an example. What is actually stop loss? It it caps the amount on out of pocket expenses, and more than that, the patient need to pay. More than that, stop loss would pay above that capping amount. So it reduces the patient to pay a sudden out of pocket expenses in which patient is unable to pay. So to reduce those scenarios, those conditions, stop loss come into picture. Revenue code. A revenue code is a number used in hospital billing to describe different services or items provided to patient. It helps hospitals bill accurately for things like test, treatment, or equipment used during the patients. Basically, a revenue code is a number used in facility. It is of 3 to 4 digits to describe different services items that is provided to patients. Next is how will you manage the conflict in your. So I will manage the conflicts in this way. Acknowledge the conflict. First of all, I will acknowledge the conflict. I will recognize it and address it promptly. Set a safe environment, discuss privately and respectfully, listen to all sides, understand each person's perspective, identified common goals focused on shared team objective, brainstorm solution, collaborate, collaborate to find a win-win solution, agree on actions, clearly outline and document agreed steps, clearly outline and document agreed steps, monitor progress. I will follow up to ensure resolution. Promote team culture, encourage respect and open communication. Lead by example, show fairness, empathy, and a positive attitude. Show fairness, empathy, and a positive. What motivating? Learning and growth. Continually acquiring new knowledge and skills. What motivating learning? Continually acquiring new knowledge and skills. Second one is achievement. Meeting goals and seeing tangible results from my efforts. Third one is helping others, making a positive impact on others' lives. Fourth, collaboration, working with a team to solve problems and achieve success. Challenges, tackling difficult tasks and finding innovative solutions. Sixth is recognition, being appreciated and recognized for my hard work. Seventh, purpose, contributing to meaningful project that align with my values. So these are the things which motivates me, that it varies from person to person. If you have something different which motivates, so you can mention your points here. Right. Question 53. If your team is facing productivity issue, what will you do? I will firstly identify causes. I will analyze data to find reasons for low productivity. I will improve training, provide additional training and updates on billing procedures, streamline process, simplify workflows, and automate tasks where possible, set clear goals, define and monitor specific productivity targets, enhance communication, hold regular meetings for feedback and problem solving, motivate and reward. I will recognize high performance and offer productivity incentives, Ensure resources. Make sure the team has adequate staffing and tools. By taking these steps, we can boost our team's productivity effectively. Next is, how will you incorporate your company values into your work environment? So that is go beyond our company ethic value. First one is go beyond, set high standards, encourage and reward excellence in all tasks, continuous improvement, promote ongoing learning and skill development, exceed expectations, motivate your team to deliver more than what is expected, think boldly, innovate ideas, foster a creative environment where new ideas are welcome, risk taking, support calculated risk and learning from failures, forward thinking, encourage long term planning and visionary goals. And the third one is partner with purpose, collaboration, promote teamwork and open communication, meaningful relationships, build strong trust based relationships with colleagues and clients, shared goal, align individuals and team goals with the company's mission, incorporate this value by setting examples, recognizing and reporting behaviors that reflect these values and integrating them into daily task meeting and decision making process. Next one is, if any user is all of a sudden going through underlying performance, what will you do? As a team leader, if a team member is underperforming, I will identify the issue, notice the specific performance problem, discuss privately. I will talk to the team member one on one to understand their perspective and any difficulties if they are facing. Provide support. I will offer help such as training, resources, or mentoring. I will set clear goals. I will establish specific, achievable target and deadlines. See, I will monitor progress, regularly review the performance and provide feedback. Next one is encourage and motivate, which is very necessary. I will recognize improvements and encourage them to keep progressing. Next one is question 56. How can you use Lean and Six Sigma Black Belt techniques using your daily life work as a team leader or quality specialist? This question will generally not ask unless you have completed Lean Six Sigma Black Belt. If you have done so, it might have asked. If you have informed to your interviewer that you have completed Lean Six Sigma, so in that way it might have asked. So you can skip this question, but I have mentioned here for those who have completed and want to give the answer. So, as a team leader or quality specialist, I can use Lean and Six Sigma Black Belt techniques in my daily work by identifying waste, continuously look for and eliminate waste in process to increase efficiency. Lean, basically what leans to, leans eliminate waste, so that's why it is based continuously look for and eliminate waste in process to increase efficiency. Streamlining process, I will simplify and standardize workflow to improve productivity and reduce variability using data driven decisions, collect and analyze data to identify root causes of problems and make informed decisions. Implementing DMAC, apply the define, measure, analyze, improve, control DMAC framework to solve problems and improve process. Encouraging continuous improvement, foster a culture of continuous improvement by regularly reviewing process and encouraging team members to suggest improvement. Quality control, tool to monitor process performance and maintain high quality standards. So these are the points through which we can use the Lean Six Sigma techniques in our daily work routine. By integrating these techniques, I can enhance efficiency, reduce defects, and improve overall quality in my team work. So I believe that has been completed. These are the questions for team leader interview. Few months back, I have already, like few months or long time ago, I have already shared one video that was related to quality, the quality specialist interview. Right. So you can go through that if you are preparing for AR quality interview. And this is the video which is for team leader interview. If you found any difficulties or any points that you are unable to understand, so you can mention in comment section. I will answer that. I will try to elaborate that point. And if you want any other video or anything, any topic on which I want to make video, so you can also mention that in comment sections. If I think that it is feasible, I'll definitely make that video on that topic. Okay, thanks very much.